That's fine. Thanks very much, and welcome everybody to this, which I think is the third of these sector-specific meetings that we've been organising on the workers' inquiry into COVID. Just by the way, background for people who might not have known, we started the workers' inquiry at last year's Hazards conference. The idea behind this one is that whilst there are very formal inquiries going on in Wales, Scotland, and at Westminster in particular, this is an opportunity for workers to speak in a totally informal environment and get their points across in a way which is going to be useful. As you can see, the meeting's being recorded. We're not particularly well attended tonight, unfortunately. The numbers are a bit low, but actually that's no problem because that means we've got a bit more time to listen to the unions that were involved in the customer sector and what their views are. And if there's time towards the end of the discussion, Daniel, it'll be quite interesting to hear if you get anything more to add about what's happening in the PI side as far as the potential for any claims are concerned. My name is Doug Russell. I'm one of the members of the Greater Manchester Hazards Centre Management Committee. I used to be the Health and Safety Officer for USDOT, I retired a couple of years back. And so we were very much involved with the COVID inquiry because we got essential workers in retail and in food manufacture, which is next week's specialist subject. So that'll be interesting to see as well. But tonight we're here to concentrate mainly on the transport side, and we're fortunate to have Rob Jenks from TSSA and Jonathan Havard from RMT here with us as well. So I think what we'll do is, if you've got anything you want to start off with a statement, Rob, perhaps about what the TSA has been doing about the issue and what you thought about the experience of what happened during the height of the pandemic. But then we'll follow up with Jonathan if he's got anything he wants to add to that, and take it from there. Yeah. So over to you, Rob.
Doug. How long have I got? Can I ask for a start?
Well, 15 minutes, perhaps 10 minutes. It depends how long you want to go. If it gets too boring, I'll start coughing and spluttering with my cold, and that'll shut you up.
Yeah, please do. Cough a few times, and I need to stop. Yeah. Yeah. Okay. Well, where do I start? Really, I think that's where I start is a statistic that comes from the railway industry. There were, as at the end of March in 2022, there have been 52 railway workers who died from COVID. Thousands were caught it, of course. The reason I know that figure is because, along with the other railway unions, our brothers and sisters in the RMT and ASLEF and Unite, we all participated in the railway industry coronavirus forum, and every couple of weeks, we had figures from the employers talk to Network Rail. But I'll come back to that. So 52 workers died as a result of COVID who were railway workers. First of those was a woman called Betty Majinga, who you would have probably heard about. She was one of our members, worked in the ticket office at Victoria Station, London Victoria. And she was coughed and spat on by an individual, and she had an underlying health condition. And on the 5th of April, Betty unfortunately died. And that was she was the first one. We mourn her loss greatly and have done ever since. 2 million people signed a petition in support of an inquiry into Betty's death. That was the only case investigated by the Office of Rail and Road. If you may know, the Office of Rail and Road is both the safety and economic regulator in the railway industry. And one of the upshots was that we made some inquiries with the ORR about how many of these deaths have they actually investigated, and they haven't investigated any of them. Betty was the one that they were forced to investigate, but the others they haven't investigated. And the reason when I questioned them at one of our periodic meetings was, well, we can't be guaranteed that the people who die have died because of an issue in work. The HSE's get out clause as well. We also questioned the ORR at the same event about an FOI that the TUC had carried out, done, and the response was from BAYS there were 60 odd COVID outbreaks at railway stations, and we took that to mean more than just railway stations, but railway workplaces. The ORR didn't recognise that figure, and they said they're aware of some, but not 60. So makes you wonder who's reporting what, where, and when, and the whole system poor. In terms of what TSSA have been involved with, when COVID first started being hitting the news, and our members in some of our London-based stations who were dealing with passengers coming out of Gatwick Airport raised concerns, and we started putting out advice to members. This was in early February 2020, and as things ramped up a bit, we created a safe at work reporting line, and the idea was that members could then report to us uh, through this line email system, make a quick report. It's a set questionnaire, and our organisers and reps would take up the issues. And that's indeed what happened. We had a number of people come forward through that. But the experiences people were having were particularly at railway stations. And a few examples will give you an illustration. So we have members complaining that we usually work from inside a ticket office. But despite the virus, we've been told to go and walk around the concourse at places like London Victoria, King's Cross, asking passengers if they want tickets, if they need travel advice, and without any social distancing taking place. I had another member who came through that system. She said, I've been instructed to stand by this ticket vending machine, and as passengers come to use the ticket vending machine, I'm supposed to wipe it clean for the next passenger. Except social distancing doesn't take place. People come forward, I'm still wiping the machine down. People don't understand when I talk to them, so they come closer. And other people were told, if you want to put protection on, find yourself a mask, put it around your face. But of course, that was completely pointless. Those are just some of the examples. And when we took this up with employers, they said, well, the official guidance says that people can come into your social distancing zone for 15 minutes, and that's no problem at all. So needless to say, this was something we took up with the employers, and I'll talk about it a little bit more about that in a moment. On the railways, we had a number of people who are essential or key workers, and a survey we've done, and I can talk a bit more about that in a moment. Probably about 45% of our members were in that category and had to go to work in some shape or form, actually physically attend work rather than work from home. And those people would have worked in the likes of stations, but also in the likes of control centres. The railway's got a series of control centres, operational purposes, with Network Rail and train operators, freight companies, whatever, and in a number of other locations like Network Rail work sites and in depots where those people work from. One of the good things that came out of coronavirus was in the March, so just before lockdown started, the Railway Industry Coronavirus Forum was set up, and it consisted of the general secretaries from the 4 unions, along with Network Rail senior managers and all the train operating companies. The freight companies and the infrastructure engineering companies, infracos we call them in the industry, who work with Network Rail, weren't part of that. I'm not sure exactly why they weren't part of it, but they didn't want to participate. They didn't. So what happened at the RICF, we had a weekly meeting, and it was an opportunity for us to be able to raise issues with all the employees and get agreements that covered the whole industry, or at least ways Network Rail and the train operators. Sometimes the agreements went into applied to Transport for London, and the devolved administrations that run ScotRail and Transport for Wales, so the Wales and Borders franchise and the ScotRail franchise and others. Some of those agreements were relatively straightforward to come to. Others required battles and threats of industrial action. I'm not exaggerating that. The first big agreement was called the Social Distancing Agreement, which covered a huge range of things. It took us about 2 weeks to negotiate. At the time, they still had the rule in about 15 minutes. So you could be within 2 meters of someone for up to 15 minutes. And this is where the example comes from. An example I use from our perspective in the discussions there, in the bargaining there. So you're telling me that one of my members who has to clean ticket vending machines can have people come and cop all over her and all the other things that they could possibly do, and she's okay. You're not talking about her in 15 minutes talking to one person. You're talking to her one after the other. Or my members who are on platforms giving advice to members at places like London, Victoria, and King's Cross. and of course they can't answer that. But that's what the effect of the government's 15-minute rule was. It was withdrawn, of course, but that was where things were. And so for about 2 weeks, we battled with the employers about this social distance agreement, and we got quite a good agreement in the end. It led to other things, other agreements coming along about the use of face masks. One of the issues we had there was that certain people, particularly in Network Rail, some Network Rail managers were saying you will not wear face masks in work. And there's one manager in particular, one senior manager in particular, who didn't like face masks. Although in practice it was Network Rail who pulled the industry up and said, "This is what we're doing. We'll supply for everybody." They actually bought a factory in Blackpool to make masks and visors in the April, and were prepared to supply all the people in the railway industry. I know that because some of my colleagues, senior colleagues, were involved in the bargaining with Network Rail about that. The RACF also set up several working parties. One of those was about people from black and ethnic minority groups who were identified, weren't they, quite early on as having a particular susceptibility to COVID. And we participated in that working party and got an agreement around a process, a series of guidance that employers should adopt, and various arrangements around that. We also participated in a working group about drivers and driver managers. Drivers are represented by ASLEF, and they can obviously speak for themselves, but we are the union that represents managers across most industry, and one of the big groups of that is driver managers, who are, as the name implies, they manage drivers. And so again, we went off to talk to the RSSB, the Railway Safety and Standards Board, about this, and we ended up getting to the stage where, unless they agreed that our members would not have to work in cabs, so you can imagine a train cab is quite small, and this is the issue. One person sitting alongside another, and the driver manager being the trainer or the assessor for a trainee driver, or somebody going through the competency assessments every few years. They have to go through competency again, and in a confined space with all the issues that would have. And they were being told, you can't wear a visor, you can't wear a face mask in the train cab, because there's potential issues for when you're driving a train, and you might miss a signal and all that sort of stuff. So the industry are very keen that this went ahead, because they had lots of drivers who needed to go through training, young, new drivers, or people who needed competency. And we got to the stage in the end, we said, on my General Secretary's authority at the time, we'll ballot our members and pull them out unless you agree that our members can have their discretion only, not to do this training. And they relented at that threat. But it took some time to get to that stage, several weeks of discussion, and a lot of convincing that we were very serious about this. And the Railway Industry Coronavirus Forum agreed that, and we obviously notified our members accordingly. The various points, we were putting out instructions to members about what they should and shouldn't be doing based on the agreements that have been reached. So that was a sort of the what was going on in the background, if you like, that sort of feeling. There were lots of events taking place in that, this regular weekly meeting, lots of things spinning out from that, different agreements about different things. But in general, the RACF was a good forum to be able to action these things. And the COVID inquiry, we've reported this through the TFC to the COVID inquiry, and our attitude has been that with all these battles that went on, fundamentally the RACF was a good forum to set up. A few other things, if I may. One of the findings for safety, and in particular assaults on staff, you may be aware that assaults on staff is a huge issue in the railway industry. Before COVID, the figures were actually beginning to decline, but the Railway Safety and Standards Board, who do a lot of research type things, policy things in the whole industry, they're essentially an organisation that is sponsored by the employers, albeit we have a certain amount of input into what they do. But their annual report for, I think, 2020-21 showed that whilst there was a lot of people not travelling by train anymore, so a lot of people are stopped using the railways, the level of assaults had actually increased substantially. I've got the figures here somewhere if you wanted them, and which is appalling, frankly, that our members working at the stations, essential workers at stations, were facing more violence, even though there are less people travelling. One of the reasons they've said for this is possibly it was people who were bedding down, homeless people bedding down at stations and then being moved on and objecting to that. But I'm not sure whether that's the full picture. We haven't got the full picture in that sense. The fact is our members are still being assaulted, and that's not good enough. And more often. We also ran a survey early last year of our members about their experiences of COVID and measures and precautions that were put in place. I won't go through all the details of that, but what it came back was showing that over 36% of members reported their social distancing had been compromised at work. Getting up by 40% said they had to go into work at all time, like I said before, and a number of other outcomes from that. The sheer fact that people had their social distancing compromised, that they were told that they shouldn't wear face masks in some occasions, and various other things. But there also a number of people came back saying that they had long COVID or were still suffering from long COVID, something like 20%, without looking at the exact figures. So I think that's probably about as much as I need to say. I think obviously there's a lot more I can say, but that's how we experienced it from our perspective in the transport industry.
That's great, Rob. It's fascinating. And some of the stuff I didn't know about. I didn't know about the forum, for example, and how that was meant to work. And I didn't know about the fact that Network Rail had actually bought this factory in Blackpool to produce some form of PPE. I'd like to ask some questions about that myself a bit later on, because one of the problems with doing this inquiry now is we've got to think about what it was like in 2020, 21, particularly 2020, when there was a lot more uncertainty about what was and wasn't going to be necessary as precautions. And for example, there was this big focus on fomite transmission, people touching surfaces. So there was a great focus on cleaning surfaces, even though that turned out to be really pointless. And there was a lot of, has been come out from the other sessions of this inquiry, a lot of failure to recognise that it was an airborne, the risk of airborne transmission in crowded places. And that was the biggest risk, rather than even close contact, face-to-face contact with people. But before I start asking questions myself and getting into the nitty-gritty of some of that stuff, Jonathan from RMT, is there anything you want to say from the RMT's point of perspective about what your members' experience was during the height of the crisis?
Of course. Again, about how long, Doug, and I'll try and tailor it accordingly. Just give us an approx 10, 15 minutes.
10, 15 is fine, yeah.
What I'll do is, while I was doing quite a bit of prep today, I've got some papers which I will share tomorrow, because one of them in particular has got some links in it, so you'll have a good set of resources there. So I'll just give an introduction, keeping an eye on my watch, from RMT's point of view, and interested to hear Rob, and I'll try not to repeat much, if any, of what he said, but a lot in common, particularly the issue of violence. I will touch on that. So bear with me as I kick off. So COVID obviously had a massive effect on the transport sector. So it was deemed an essential service on 20th of March 2020. Our members, just as other key workers, had to continue going into work throughout the pandemic, both during the lockdowns and the subsequent easings. And that's when they were subjected to greater passenger numbers and more infectious variants. There were disproportionate levels of fatality amongst bus drivers. I should say I'm going to touch on buses and maritime, so it's a little bit broader than Rob. There's no one here from Unite, is there? So they have a greater penetration on the buses, but we do have some significant groups of members. So there were disproportionate levels of fatality among bus drivers, high levels of infection amongst workers, which have led to service cuts and reduction. So at one stage, 1 in 3 Transport for London staff were self-isolating. The pandemic also placed our public-facing members on the front line of public health policing, subjecting them to rising levels of aggression and violence, which Rob touched upon earlier. So a proper narrative account of what's happened in transport has to take account of the overriding context that determined our members' experience, which was the contradiction between the recognition that transport was an essential service and its deeply fragmented structure. So our members had to continue coming into work as an essential service in order to keep other essential services running throughout lockdowns, and play their part in freight and logistics chains that kept food and medical supplies moving, for example. But this was delivered through a deeply fragmented system in which a range of different incentives were at play, often in tension with public health concerns, especially the need to generate revenue and maintain profits. So this systemic quality determined government policy response, which reflected this fragmentation. And this policy prejudice in favour of advisory policy to complexes of private sector transport companies also reflected back on employers and created a range of tensions, struggles and unevenness of experience of the pandemic. So I have some examples to share with you. May. Department for Transport's May 2020 guidance on safe travel for operators and passengers. This was issued with 24 hours notice before people expected to return to work and start using public transport again. The guidance was consciously advisory and placed very little obligation on employers in the sector. In the rail industry, this then had to be translated into industry guidance. And again, Rob mentioned this was done through the Rail Industry Coronavirus Forum, RICF. This convened a body of more than 20 companies and organisations and a supply chain of scores more beneath them. However, in the bus and the maritime sectors, there was no equivalent of the RICF. Devising safe systems of work and their continued risk assessment as guidance changed and was then devolved onto individual companies and had to be policed by unions. And this was obviously better done where unions and health and safety structures were more effective. But even where you did have these, for example, in train operating companies, we had staff with revenue collection duties who were under extreme pressure to collect tickets in crowded carriages when they were clearly at risk at work. So some felt unable to conduct dynamic risk assessments and invoke work-safe procedures, which, of course, we always encourage our members to do. Devolving the duty to enforce safety guidance onto these staff in the form of enforcing mask wearing, then put them in the front line of new levels of risk and violence, particularly when guidance changed. So on Transport for London, TfL, 50% of respondents in a survey we did reported being threatened with physical violence. 87% reported verbal abuse. 14% reported being spat at or targeted with bodily fluids. On the wider rail network, more than half reported being threatened with physical violence, 10% had been physically assaulted, and 16% reported being spat at or targeted with bodily fluids. HSE guidance recommended that employers conduct individual vulnerability risk assessments for Black and minority ethnic staff. Some employers, such as TfL, Transport for London, did this. Many others didn't. 76% of RMT's Black and minority ethnic members who we surveyed reported that they hadn't had this individual vulnerability risk assessment, 76%. Sick pay was a massive issue. And I'll turn to the maritime sector here and ferries. So Stena Line run ferries attempted to cut its sick pay provision to the statutory minimum just as the COVID pandemic was kicking in. Many bus operators didn't offer more than statutory minimum in any case. Subcontracted cleaning companies on the railways don't offer any occupational sick pay. So all our surveys showed that where this was the case, these workers came into work when they were sick, including with COVID, continuing to transmit the virus just to support themselves. Back to the ferry operators again, and some ferry owners attempted to keep bars and restaurants open even after the government instructed land-based bars and restaurants to close. So we had to lobby the Maritime and Coast Guard Agency on this. We had constant struggles to get PPE provision to crew. There was crowding of passengers, including freight drivers, and the role of flag states in undermining the UK government advice on social distancing and other anti-coronavirus measures in place for land-based workers. So you can see specific issues for our maritime people, and that's without going into the whole issue of being isolated, stranded, having to stay beyond tours of duty, etc. I haven't got time to go into all that now, but that's just one example. So the basic point is government decision in making the transport sector can't be understood or assessed without understanding the wider composition of the industry and the actions of the various agents in it. Still got 5 minutes. I say I'm not going to go into too much detail in some of the other points I'm going to make, because I'm going to share it via email with all the links, etc. So I'm just going to find something that may be useful to bring to your attention. What I'm going to focus on, I think, is the violence. Okay, I've touched on that already, as Rob. And I think all the stats I've given you are in the paperwork I'm going to send you. Just see if there's anything else I haven't covered. Yes, I think I've covered most of the things here. 58% of all staff, 67% of those in public-facing roles reported workplace violence since the beginning of the pandemic. 60% said it had got worse since the pandemic. 82% said they believe that the lifting of the COVID-19 restrictions in July 2021 and mixed messages created by this led to an increase in violence. So I'll stop there in case there's any questions or clarification, which I'm happy to try and provide. I've got a lot more information here, but as I said, I'll share it with you. I've got a whole letter by one of our parliamentary group, Mick Whitley MP from Birkenhead, on the issue of Stena Line and the sick pay, again, which I'll share with you. So thanks, Doug, everyone.
Thanks very much for that, Jonathan. That's very it's good you spread that out to buses and road transport, and also particularly to the ferries. It's just an area that gets missed quite a lot. By all means, send anything you've got in paper form, with particularly the links, through to Janet, and we'll make sure that gets attached to the recording for this and gets distributed. Is there anybody who wants to come back on anything that Rob or Jonathan has said, first of all, before I start picking up on some of those themes? Because some very strong themes came through there that have come through in other sectors as well. I think it's worth looking at it a bit more closely. Anything from Hilda or Janet or from Daniel? Perhaps I could start there with, yeah. First of all, one of the things I hadn't heard about was this thing about Network Rail actually deciding to produce its own PPE and provide it to the rest of the rail industry. I'd like to know a little bit more about that, Rob, if you could. When they said they were setting up this place to produce masks and visors, when they were talking about masks, were they talking about face masks, about fluid-resistant surgical face masks, or were they talking about FFP2, FFP3 standard respirators, or disposable respirators that would provide more decent protection? or was it just the simple kind of face coverings along the kind that were being widely used throughout the earlier parts of the pandemic and still widely used in sectors like health where they shouldn't have been seen as appropriate protection? Yeah, you're muted, Rob.
Yeah, sorry, I'm just taking myself off. What they did, the standard facial masks, not a FFP3 or 2.
So there were surgical masks.
Surgical masks and
yeah,
face visors that people could put on their head and pull down
yeah,
in front of their face like that. And
yeah.
that's what they did. I believe it was in the April of 2020 they did this. I'd have to check to get the details from you, but certainly we have a team of negotiators in Network Rail, and it was them who advised me. I was on the RICF doing lots of other things, but they dealt with the Network Rail things within Network Rail. And this is what the advice that they gave me at the time, that they'd actually, I think the chairman of the RICF, who was an RDG person, he also mentioned this thing that Rail might have mentioned it at RICF as well. So it was fairly widely known, and the offer was certainly made to the train operators by Network Rail that we have sufficient masks and visors that we're prepared to supply other organisations as well.
Right. Because one of the other things I think I heard you say, Rob, was when some of your members objected to having to stand by the ticket machines and sanitize the ticket machines between people using them. And obviously social distancing was very difficult, and they were face-to-face contact with lots of customers. So you said, find yourself a mask was what some of the managers are saying. Is that right? That they weren't even
right.
thinking about providing that basic level of protection to the
provided
staff?
nothing. Part of the thing we did with our Safe at Work online system was we asked people to supply details, and amongst those things we're saying, have you been supplied with a mask? Have you been supplied with um, any sort of equipment, including how to sanitize your hands and instructions about washing your hands and all that. And whilst those sorts of things have been provided, face masks are one of the things that hadn't been provided. And the person who came back to me saying about having to wipe the machines down, she said, I was given an old scar, which rapidly becomes wet as I breathe through it. And in between passengers, I have to wipe the machine down so they don't catch anything. That's how the advice was at the time. But because they'd always break social distance, and you'd be standing next to me as I was wiping it down, one person after another, after another, after another. And
astonishing.
back
Even
was
given the level of what they could have argued, there was limited level of knowledge about what kind of respiratory protection might be appropriate, but even that's ridiculous in that sort of circumstance. But given what was happening in other sectors at the same time, and one other thing that you talked about at the beginning of your story when you mentioned the example of the tragic example happened to Betty at Victoria Station. The issue of these cases that happened in the rail industry not being reported to RR it does mirror what happened with HSE, because HSE's guidance, of course, was designed to actually discourage reporting of any individual cases of COVID under radar, unless it was very obvious that they were specifically linked to somebody doing a job in a laboratory, for example, or they're exposed to the virus. You said that ORR did investigate her case. Just for clarity for the others in the group, what was the outcome of the investigation? If I remember rightly, it was that they couldn't assign any fault to the employer in that case.
That was exactly it. Yeah.
Yeah.
That's exactly the outcome of that situation. They told us that they followed HSE guidance, as I explained. I don't need to say any more about it, but that's what they told us about.
Yeah.
And the sheer disconnect, and you could tell they were a bit twitchy about it. And the fact that all these outbreaks that have been attributed to the railway industry, they couldn't verify that figure. To the TUC research, Shelley's research at the TUC have brought this FOI forward for a number of sectors, and that one for railway stations, it said, we interpreted that broadly because it's a railway, it must be a station sort of approach. But nevertheless, we were aware of some, but the ORR weren't aware of any of that number, that 60-odd number. They said we were aware of some, but nothing like that. There was one in Plymouth, for instance, one in Manchester. They were the sort of ones that we were aware of. Outbreaks in ticket offices or depots, whatever. But there weren't anything like 60. So that suggests somewhere along the line the figures were wrong, or the ORR just weren't doing their job.
Yeah, well, I think the issue of outbreaks is probably one that'll be more of a focus next week when we're looking at the food industry, because that was where a lot of the big outbreaks were happening. And again, there were difficulties with identifying them when they happened and quickly enough to do anything with them. Jonathan, I've got a couple of questions for you, because I think, again, there was a couple of bits that you picked up on. Okay, both of you mentioned the issue of violence, and I think the figures that you in particular were quoting, Jonathan, I'll be interested to see the figures when you send them through to Janet, but they don't sound to me to be out of kilter with what's happening, certainly in retail over that period, and in health and in other sectors where there were still public-facing workers. And I think you're right that one of the key issues was when they introduced requirements for people to wear face coverings in enclosed public areas. That was one of the flashpoints for an awful lot of the violence that people saw. Yeah.
Absolutely, Doug. I mean, what it is, again, I know that this will apply in shops and cafes, bakeries, what have you. But workers wearing uniforms become a focus of attention. And we were quite clear, as I'm sure with the other transport unions. We told our members, you're not there to police things, okay?
Yeah.
You know, you're there to advise. If someone isn't wearing a mask, you advise them, but you don't instruct them, okay? That's not your job. However, even simple advice would provoke.
Exactly. There were some people who were extremely
further.
hostile. Yeah,
Absolutely.
yeah.
Absolutely, and again, that's that is down in part to appalling human behaviour, fueled by frustration, and confusion spread by the government at the time as well. But the workers on our gate lines would become a focus, as would those be doing the ticket collecting and so on. But yes, it doesn't surprise me, sadly, that the same, and I'm aware from what I've read about the issues that unions like Asda and Bakers Union have faced along similar lines. Yeah, and certainly, there'll be plenty of stats in what I'll send over. I have referred to them, but you'll have some of the sources in what I send. Yeah.
And one of the other themes that you picked up on, Jonathan, that I think is very important, again, in other sectors, it turned out to be an issue, was the issue around sick pay, statutory sick pay being inadequate for people who are dependent on that as their only.
Well, I reduced it to one sentence, really, but this is the key, isn't it? The poorest paid workers couldn't afford to take time off on sick leave. All right. So they come in, prolong their own illness by doing so, and spread it about a bit just for good effect. All right. We can't blame the poor souls who are forced to have to do that. It's the poor employers that don't pay a reasonable rate. So this wasn't an issue at our biggest employers, Network Rail or the TOCs. But when you come down to, let's say, the poorer paid, the cleaners, and this was an issue in on the buses as well, and with some of the maritime sector. Not all, I hasten to add, but I mentioned Stena, who are now promoting themselves as, post P&O, the champions of British seafarers. Yeah. Short memories.
Hilda, you've got your hand up for some time. Do you want to come in?
Yeah, thanks. That was really interesting, both of you. Thanks very much for that. I'd just like to ask a bit. I know we all know that much of the information and the guidance was very poor, concentrating far too much on surfaces and fomites when we all know COVID is spread through the air, and the main things are obviously proper respiratory protection, FFP2 and FFP3, and ventilation in certain places. And I just wondered if either of you could say a bit more about what, if anything, you did or found out about ventilation where it was appropriate in, for example, in drivers' cabs where there was somebody there with them training with them, and also on trains, where what levels of ventilation expose both passengers but also workers to great risk, and what is actually going on now. I travelled a lot on the train, and I take my Aranet CO2 monitor with me to mount the proxy for ventilation. And I have to say that on many train lines, I have measured CO2 levels over 6,000 parts per million,
Do you want to go first, Rob, or shall I?
I can say a few things.
Oh.
If I go first, and then
Yeah,
you come in with your expert analysis. In terms of the differences, initially, of course, it was all about surfaces, wasn't it, and droplets and everything like that. And this is how the RICF, who we function through an awful lot, they would produce people who were so-called experts in this area, and we'd have discussions with them, and they give us advice from that. But that began to change as the research changed, and it became obvious that it was more about aerosol sharing. One of the points we had in relation to in-cabs was, as I've explained before, was the point about the closeness of everybody, and the fact that they've been told you couldn't wear a visor, you can't wear a face covering because of issues of the safety of the train, and whether that would fog up glasses if you having to wear glasses and that sort of thing. Those are the sort of reasons they were using. Hence the reason why we took the step to say, well, we just don't want our members there, thank you very much, and we'll ballot our members if you insist on that. And that was the style we took, and that's the agreement we got, was that members wouldn't have to do that. It's interesting that in the classroom setting, they already had measures in place which would eliminate social distancing, just in the cab where the vital issue was taking place. We also got some information from the TUC. I can't remember the chap's name was now, but it was a London-based, I think he's an emergency medical practitioner, a doctor, who did some research on a Great Western train. And I lived down in the Bristol area and used to bargain with Great Western. And when I worked on the railway, it was part of not the Great Western Company. It was British Rail in those days. And so we took this issue up with Great Western, but they refused to believe it. And I dare say they talk about venting the train 6 times on its journey. It's when they open the door to let the passengers in. Most modern trains don't have ventilation in the sense that you can't open a window. They may have an air conditioning system, but they don't have any windows, unlike the old trains where you could walk the window down if you wanted to. Even then, it's within a contained unit, and that's usually within the zones at each end, sometimes referred to as crumple zones. So in the event that you have an accident, those get squashed by the concertina effect of the train. A lesson there, you actually stand in a train. But that's about as much as we did in that sense. One of the things also I should mention is we did have 1 or 2 people who were experts in this area from the Railway Safety and Standards Board who were able to advise on some of this stuff, particularly around the change in research over the time. But it was clearly too late for a lot of people. And that's the point. Sorry, I waited on too long. Sorry.
Jonathan, anything else you want to add to that?
Excuse me. Need a sugar boost. No, Rob has covered that very well. Just a couple of things.
Fine. Yeah.
Thanks to Hilda and to Hazards for all the stuff that you put out on ventilation, which we used. It was very useful. And Rob has said about ventilation on trains and the need for proper air conditioning systems, and we used Hazards resources when arguing for that. We constantly argued for at least FFP2, if not FFP3, face coverings, with the exhalation valve closed, I believe.
Yes, yeah,
That was
because
important.
that was just spraying the virus out if you were infected yourself. Yeah.
Exactly.
Yeah.
Always the answer. Too expensive. Cost rather than safety. That was.
Yeah.
So But yeah, ventilation. Yeah, we've had issues about workers working in small offices where there was maybe only one or two of them. Difficulty in opening windows, no air conditioning systems, for example. With buses as well, it was a bit of a struggle, but we more or less got there in the end to have the perspex screens to protect the drivers. But that was a battle, and again, it's all, you've mentioned it many times already, the dawning, creeping realization that this virus is actually airborne rather than, touching handles or handrails or what have you.
Yeah.
So that's it. I think Rob's covered it very well. But again, this is where hazards really came into its own, and we were really grateful for the advice you continue to provide. So thanks.
And there was one other thing that I think Rob mentioned, which I'm puzzled by, which perhaps Hilda can help out with as well. At the beginning of these discussions where you were concerned about social distancing, which obviously would be a big problem for staff who are on the platform working alongside the public in lots of situations, and was a problem for bus drivers on buses outside of TfL, where there's only one way you get on a bus in Manchester. You don't get on at the back of the middle of the bus, and you have to stand face to face with the driver, buy your ticket, or to touch the screen to record your journey if you've got a ticket to do that.
We had all sorts of debates. I remember one debate about the importance of station staff, the importance to the public of being able to see their lips move. So I remember there was a lot of talk about.
Yeah, well, that for some members of the public that might well be an issue, but there were some ways of getting around that if you had to. Yeah.
Transparent. It is an issue.
But the point that Rob said that puzzled me was this thing about how you could be, somebody had to be in your close contact zone for 15 minutes before there was a risk, which, from my limited understanding of if you accepted that close contact was a risk because of droplets, that doesn't make sense. That's
no sense whatsoever.
Yeah. Have you heard that before?
Yes, that was, I think, at the start before more knowledge kicked in, if you like. But yes, it's a nonsense, Doug, as you say. Yeah.
I think in the railway industry, it was if I may just briefly, I recall that it was in the June of 2020 that the Secretary of State for Transport said face masks should be worn on trains. Well, that was 3 months into the issue, and I distinctly remember when we were having our social distancing conversations and battles with the employers, and that was in the end of March, beginning of April. This 15-minute rule was in place then, because I distinctly remember saying in our bargaining with them, okay, are you going to stand on a station for 15 with a series of passengers, not just one person for 15 minutes, but you go one after the other. If you wipe down the machine, or we try and sell tickets or give advice, and a person comes in your space, coughs on you, splutters on you, then you have another person. If you might survive the first one.
Can I ask, Hilda, have you heard of this 15-minute rule before? It's not something I'd come across.
Well, not until they started sort of talking about it, and it was basically a complete nonsense. And I think it was something that was just sort of invented to make us to sort of make work possible, to not be too restrictive. It wasn't about, the reality of this is, it's not about people necessarily coughing or spluttering. It's about people breathing. Exactly. Generates aerosols. And clearly, if you're standing very, very close to someone for a very, very long time, then you are in risk of inhaling a huge amount of concentrated clouds of aerosols from that person. But the reality is, that very, very few aerosols is enough to make you ill, and you can inhale them in a matter of seconds. So in terms of infection level, it was a complete nonsense. And it was an economic decision about making work possible by, having sort of some pretend idea of that was safer. And it was an extreme, it sacrificed workers' health, and it was a very bad idea.
Very bad idea indeed, yeah. And certainly something I'm not aware of HSE, for example, all the research they were doing for the Protect network and the stuff that was going on with Kathy Noakes and all that kind of stuff. It was never
well, they did. it did sort of come up, and the HSE spent a huge amount of time looking at the orientation of workers to each other, didn't they? They spent all that time looking at workers working on construction sites, and was it better for them to work side by side,
back to back,
facing in opposite directions, or
yeah.
back to back, and all that sort of nonsense, which was all about minuscule. It was a way of about trying to pretend you were protecting people, but it's about still making work possible. It was nonsense.
Can I just say that that's similar to what happened in education as well? So they're saying you could go into close contact for so long, like or that close contact with other people that was available. I suppose I was interested in what you were saying about when about the lack of investigations that were done, and how many concerns were registered with the were there any you've got equivalent to RIDOR reportable in the
RIDOR would apply, but we ORR report to rather than HSE presumably.
Yeah, so it's what happened there, and I also the case that you raised, Rob, at the beginning, that was as much bullying as anything. I mean, that was an awful case, wasn't it? Where you were forced into going on to the out of the ticket offices. They were forcing people who were vulnerable out of the ticket offices and were exposed. And then they weren't, when they reported that they've been spat on, that they weren't investigated by them. It wasn't registered by the managers or investigated immediately. I mean, it's a horrific example. And that poor woman that died as a result of that, and others that have probably died as a result of it as well,
Yeah, our organizer at the time, she was incensed, as you can imagine, by that, and made the appropriate representations and achieved what she did in the sense of stopping some of these things. But it was too late for Betty, unfortunately. And
yeah.
It's unbelievable.
Dr. McDaniel, in very quickly, if I could just ask him a question.
I was going to ask Daniel. I was going to say, why doesn't Daniel say?
The question I've got for you, Daniel, is first of all, have you had any or many cases coming your way from the transport sector as a sector that?
We've certainly had some, and I listened to all that with great interest, particularly interested in the sort of. I've come at it as an industrial disease lawyer, looking at understandably the COVID cases, as it were, but also the assault element is really, really interesting, because obviously we deal with a lot of workplace assaults, and it doesn't strike me. It's hard to imagine there'll be certain situations where there may be valid cases there if employers are, for example, overextending things and saying, well, actually, you've got to, it's not advising, you've got to, in certain scenarios, enforce it. Well, what do you do if, a member of the public is becoming aggressive, etc.? There may be those sorts of cases where actually, there were viable claims there, but they're obviously put in a very, very difficult situation as far as workplace violence goes. But on the COVID point, I was interested to hear, I think it was Rob saying, some of the changes that you managed to push through, which is really, really interesting, because lots of the cases, understandably, we've seen have been frontline health workers. And for the most part, the guidance was what it was. It changed, weekly, etc. Everyone on this call probably didn't agree that it was clearly fit for purpose, but that's another issue. But I can't recall a case where the workers on the ground sort of pushed through anything, in terms of any substantive changes, certainly during the early stages. But the sort of thing that you're talking about as far as the training in close proximity is a really interesting point, because again, it's all fact specific. You've got to put that caveat on it, but that you could envisage scenarios where somebody's put in that position, they're with a manager or a supervisor trainer who is symptomatic in that scenario, and if ultimately that policy, they change that, you could foresee an argument where you say, well, actually, they should never have been put in that position. And those are, when we went through this exercise, when we look at all the different scenarios, and we had advice from respiratory physicians and lead disease counsel, etc., as to how to, what type of case might possibly stand up here. The best cases, in theory, are going to be the cases where we can say, number one, on balance, they got it at work, but number two, our argument on breach of duty is a nice, clean argument, and the best one is they should never have been there. So the same point goes to your sort of black and ethnic minority workers who are maybe, if they're if they're of BAME origin plus a significant health issue, can we say they should not have been there at all? They should have been at home. But the training scenario, you just say, well, look, did they need to train them in that scenario? And now we clearly have to prove that on balance, that's when they got it. But it's a really interesting point, but all fact specific, of course. But no, it's really, really interesting.
Thanks for that, Dan. Any other points that anybody else wants to bring up? Because I think we're sort of dealing. Yes, Hilda. Yeah.
Yeah, just following on what Daniel said. I mean, basically, we're talking about the precautionary principle. Should workers have been put in certain sorts of positions, and the issue around, around the guidance and the fact that it was known fairly early on that this guidance was wrong. It was known fairly early on by experts who were making it very clear, as we were trying to do, that COVID was airborne, as SARS-1 was airborne. So SARS-2 was highly likely to be airborne. And you're talking about, the workers you've been talking about were being put deliberately in positions which were going to expose them based on completely inaccurate garbage science and inaccurate guidance. And what I'm really interested in is how much we could have or should have or still can challenge that legally.
Yeah, well, that's going to be. Sorry, Dan.
Yeah, go on. Sorry, no, I was going to say. I mean, these are issues that we discussed at length with lead counsel as far as particularly looking at frontline health workers, not necessarily, although the point sort of transfers over, but to what extent we're challenging the guidance itself. And the firm view there was that really you look at, to open that up, you've got to go down the judicial review avenue first, really as a sort of a bedrock, and then sort of use that as a springboard. The advice at that point was that it's not without any merit, but just that the prospects of success were certainly significantly less than 50%, but it is something that we considered at the time. But what we're ultimately left with is, well, if we're pursuing individual employers, we may not like the guidance as it is. Now there's clearly an inquiry ongoing, and we'll have to see what comes out of that, whether there's a scheme at the end of the day, or what the results are and what the findings are. But we're left with a situation where, to a large extent, we've got to hold up the guidance against the employers and see whether they complied with it. But it's these other types of cases, if we put to one side to some extent the mask issue, where you've got an argument where you say, well, look, this is the breach of duty, and it means that this individual would, on balance, not have been at work. They shouldn't have been there. They shouldn't have been in this position for one reason or another. On a fact-specific basis, are in theory the better arguments, as it were, rather than going down the challenging the guidance route.
Yeah, I mean, I can you can sense the frustration, I think, Daniel, amongst
absolutely, yeah.
And there are two problems with the guidance. One is that the guidance that we're talking about was actually guidance based on public health, and actually poor public health advice. And even the sector-based guidance was actually still essentially public health guidance rather than based on employees and employers. And there wasn't any efforts by HSE. It's interesting about the forum in the rail industry. There wasn't any effort by HSE to actually do something about producing sector-specific employer-based guidance, even based on that very loose general guidance was around, which is where a lot of the frustration comes from, because in those sectors where there were unions, they were spending a lot of time with employers trying to thrash that out and trying to reach some kind of a consensus about what would and wouldn't be appropriate. And it was very difficult and frustrating, and made worse by the fact that there was different guidance in the different authorities. In Scotland and Wales, there were different standards that had to be followed as well, which made things even more difficult. So it's not an easy one at all. I was just
going to say one thing, is that health and safety law didn't change. No matter what guidance came in,
change at all. But HSEs took a back step because they said this is a public health issue and it's ultra virus for us to actually interfere in it, which is their approach to any epidemic, which is a community-based epidemic, which I think
it wasn't dealt with as a public health issue either.
Well, it was badly as a public health issue. I think most people I know were public health experts have got their comments on that, but.
Anyway.
It wasn't dealt with well as a public health issue, partly because all of the guys was based in the idea was it could be another outbreak of flu rather than another SARS outbreak, and that was part of the problem from the outset. But there we go. Fascinating stuff. I mean, it's interesting that in this sector, certainly in the rail sector, there was a lot more going on, which is indicative, I think, of the fact that it's a sector which is very well organised, and the unions are actually still quite influential in that sector. Contrasts amazingly with maritime, for example, and people like Stena. I'd love to talk to you again, Jonathan, in more detail some days about how they dealt with outbreaks on board ferries, particularly when the staff were accommodated on board the ferry themselves, and how they kept that sort of side of it.
Get in touch. I might get one or two of my colleagues involved, but yeah, feel free to get in touch, Doug. Yeah.
And then there's the whole thing with bus and taxi drivers, which is something which is very significant. And interestingly, of all the other employment groups that the Industrial Engineers Advisory Council are looking at, the one that the experts and IAC had biggest sympathy for and would like to have had more information to actually make recommendations on, I think, would generally be the road transport, particularly the bus drivers and the taxi drivers.
Absolutely,
a very difficult area again to get to the bottom of.
Bring in Rob Miguel. I'm trying to remember the name of Rob's colleague, but I can't. But
Luke.
Sorry,
Luke
Collins.
Yeah.
Bring them in on buses and taxis as well, Doug.
Yeah. But thanks very much for your time. That was actually, although the numbers are small, that's been a very useful session, and it's all been recorded, so it'll all add to the body of evidence that we're building up on this discussion. If you are interested, next week, the same time, same place, it's going to be the food industry we're looking at.